This is Heart Rhythm TV, and I am Julie Shea here on another segment of Advancing Allieds. Today's topic is about how to write an abstract. All across the world, every day, allied professionals working in device clinics, working in EP labs, taking care of arrhythmia patients, pharmacists, and genetic counselors come up with great ideas about how to manage patients better, how to run clinics better, system improvements, quality improvements. And oftentimes they share these ideas with their colleagues. Hey, did you hear about, I came up with a great idea today about how to do this a little bit differently maybe, or you saw something with a device interrogation that was unique and different that you'd never seen before. And you talk to your colleagues about it. And your colleagues may respond back to you, wow, that's a great idea. You should write that up. And you're like, yeah. And then kind of stop and think to yourself, ooh, I don't even know how to get started with this. So today, over the next 10 minutes or so, we want to provide you with an overview of how to get your research started, or how to present your research, and how to present any interesting clinical findings that you may come across. So let's start off by talking a little bit about what is an abstract. So the definition of an abstract is basically it's a concise, descriptive overview of a scientific project. There are several components of an abstract, which include the aim of the research. So what's the background on it? What do we already know? And why is this important? We also look at the objectives. We look at methodologies. So how are we going to accomplish this? Is this a scientific study where we're looking at variables and we want to create a spreadsheet with an Excel database, how we're going to input the data, so how we're going to actually accomplish this? Or is it more of a clinical type study where you came up with an interesting finding on a device interrogation and you want to report that? And then lastly, your results and critical findings. So having a discussion about what you found, what is new and innovative about it, how your findings relate to other similar studies, and future considerations. So why are abstracts important? First and foremost, they advance science. I have some colleagues that will be joining me shortly to talk a little bit more about how they did their abstracts and the importance of why we need to do abstracts. So again, kind of advancing science is one of the cornerstones of research. Another indication or reason for doing it would be proof of concept. And then lastly, quality improvement is another kind of cornerstone of why we do research. So in terms of research types for allied professionals within the Heart Rhythm Society, there are 4 different kinds. A scientific study, which most of you are pretty familiar with, that, as I mentioned earlier, kind of having data points and variables and looking at statistical analysis about how these variables interact with each other. There's also provocative case-based studies where, again, you come up with something interesting that you've seen in clinic, never been seen before. Like, for instance, I saw a patient whose ICD kept beeping several times. So it was a steady tone, something suggestive of a magnetic interaction. I saw the patient in clinic, and as it turned out, that it was his vaping device that was in his pocket. And I looked, there was nothing about it in the literature. So I wrote that up, and it was actually published in Heart Rhythm case reports. But just something, a simple clinical interaction like that is important information to get out there. Proof of concept or innovation. So the pandemic was an impetus for many different system improvements, right? So because out of a need, we had to kind of pivot and do things differently. So a lot of great research at FHRS this year came out of kind of innovation for process improvement as well as quality improvement. So those are kind of the 4 tenets of abstracts for heart rhythm that allieds can base their clinical research on. So now I would like to move to introducing you to some of my colleagues who will be talking a little bit about their research experience. We have Brynn E Dechert-Crooks, who is a nurse practitioner at the University of Michigan. Brynn is also the council chair for the Allied Professionals. We have Linda Ottoboni, who is a nurse practitioner at Stanford University, and she oversees the atrial fibrillation lifestyle and management program. And lastly, we have Lauren Rousseau, who is a physician assistant at Brigham and Women's Hospital. And Lauren was actually the 2021 Allied High Point scoring abstract for this year. And I believe that in 2019, she was also the high scoring abstract writer for Women in EP. So I'm going to move this next segment to talking to my colleagues, and they will be able to share their experiences with you.
So how can we become more efficient? How can we help our patients more? And so this year's abstract is on virtual care for our patients, which is obviously something that was a big hit this year with COVID. But really, you can take any idea and turn it into research. If you look at what you do every day, I think it's important to improve upon it and then research it and move forward with that idea.
I think for getting started writing an abstract, think about a clinical case that you've worked on that has been really interesting, and develop the case presentation. That's a great way to get started, because if it's of interest to you and your colleagues, it's usually going to have a shared interest amongst other members of the HRS. Secondly, I would take maybe a clinical question that you've come up with or have had some ideas or thoughts about changing clinical practice that you have maybe evaluated or sorted out, and that makes a good abstract, particularly if you've gone and done some reviews of either the literature or you've reviewed your clinical data prospectively or retrospectively. Those are great places to start for creating an abstract, and keep it simple. I think everybody's ideas are always worthwhile. So take something that has been of interest and maybe initiated a change in practice, and then go from there. And good luck. I know you're going to be great. So go out and get started on writing your abstract.
I came up with my idea based on a new program that we were working on at my institution, and it is run and developed by allied healthcare professionals, and so I thought it would be a great opportunity to share that amongst the Heart Rhythm team. I think that one thing when you're coming up with an idea is important to distinguish how your idea is going to be different from everyone else's. So the COVID-19 pandemic and same-day discharge for our patients was really important, and we were distinguished from other institutions in the way that we sent patients home with objective data monitoring and incorporated telehealth care.
So this year's abstract, I talked about, again, virtual care, and that is something that we started even pre-COVID, and we were doing it often enough that we were able to collect data on it. So really, once you have the idea, it can develop itself, especially if you run with it in your own practice on a daily basis. I think that's important. From an allied professional standpoint, we do have a different perspective on how our clinics run, how we take care of our patients, and I think it's important to utilize those skills.
I further developed the abstract idea by going and reviewing charts or talking with team members to try to see if we had enough data to actually present, along with maybe an EKG or echo results, any kind of clinical results. So trying to determine whether or not we had a story to tell in the abstract.
So I developed this idea for this abstract by incorporating other members of our team and really bringing in multiple levels of the healthcare professionals, so physicians, nursing staff, technicians, and coming up with this idea of how we're going to best optimize our patients and improve patient satisfaction, reduce hospital resources, and present that data to the Heart Rhythm Society.
But in studies that I've done in the past, I have used statistical analysis, but I use a group that we have in our own institution, and I ask for help. It is one of my weakest points. I'm not well skilled in statistics, but we are a team, we collaborate, and we ask others to help us out who have specific degrees in statistics. So I think it's important to find a group of people to work with, collaborate, and have everyone's strengths come into play. So again, I'm not that strong with statistics. I can do basic statistics. I use actually internet sites to be able to do that. But for major statistical analysis, I do ask a group of my team members to help me with that, and I think it's important to do that.
We use statistical analysis that were appropriate for analyzing and evaluating the data. So in some cases, there are pre-post testing that was done. So we then were using data analysis appropriate for that. Or if we're trying to make an association amongst variables or different characteristics, then we would have used a data analysis that was appropriate for that. Additionally, if we were trying to compare between groups, then we would use analysis appropriate for that. And there's also qualitative results where you're looking at a thematic analysis, and we would then use appropriate analysis for that.
Statistical analysis is actually probably my weakest point in developing an abstract. And so one thing that I've learned is always asking for help or establishing a mentor. And it's probably the most difficult part of any abstract. It takes a lot of time, and I think one thing I would recommend to someone who's establishing an abstract for the first time is to really know the data and give yourself ample amount of time to understand it and reach out and ask for help.
Once you get the abstract completed, most of the work has already been done. In order to do a background, you do a literature search, and then you have all the data. So really, it's written itself. So I would go one step further. I think the hardest part is getting the abstract out here, but go one step further and publish the data. You have done all of the work already, so it really just takes a little bit longer to get this idea out there and published. And I think it's important also for two reasons. One, as an allied professional group, we really want to be part of the academic world, and I think it's important to be able to do that. And two, again, you've worked so hard already that it's worth getting your name recognized in a journal.
I am going to publish the results of my findings. I want to share with you that you really should start writing your manuscript when you submit your abstract. I have not done that, and I have a mentor who now strongly suggests that, and I realize the value of doing that, so that by the time you present your abstract, you are ready to submit your manuscript. And I think that is a great word of wisdom. I wish I had that from my mentors long ago, but I think it is important to continue to share the results to a bigger audience, and publication is the best way to do that.
So I do plan to write up this most recent abstract, and I think that it was a great opportunity to be here and present at the conference. I also think that there were a lot of questions that were asked that I had not answered or thought about, and so it was a great opportunity to sort of think of other avenues and other things to incorporate when I do publish the abstract.
I'm very lucky that I have wonderful mentors that I work with, that I have been working with for the past 14 years, that work in my institution. But also Heart Rhythm Society now has a mentorship program for allied professionals. And if you have if you're interested in learning more about that, you can go to the HRS AHP communities pages, and you can sign up to be a mentor or to be a mentee. But mentorship is something that I believe very strongly in. I have been very lucky to have such wonderful mentors, and I hope to help others and become a mentor and help others publish and research. So I think it's, again, important to find a mentor out there.
I think if this is the first time that you are pursuing an abstract submission, it's really important that you find a project that you have had fun with and have really enjoyed, or you're reviewing a clinical case study that has really intrigued your group, or you've learned something from. So something that you can really enjoy sharing to an audience. Maybe there's a quality improvement program that you have set up based on a clinical question that came from your clinical work. And it's chances are that if it's been important or intriguing to you, it will be important and intriguing for the entire HRS audience. So very important to share that amongst the group. I also want to just share that it's so important to be consistent in your writing the abstract. So use consistent terms throughout the abstract. When you describe something at the beginning, make sure you're using the same word in the same order of variables throughout the abstract writing. It's just more clear for whoever's reading it to be able to understand the project.
So some suggestions that I would have for other allied healthcare professionals that are working on establishing an abstract for the first time would be to keep a list of ideas or opportunities. I keep a running one on my phone, and just remember that no idea or thought or case is too small or too little. The other thing I would recommend is performing a literature review, attending the heart rhythm sessions, and really seeing what's out there, what other people are doing. And most importantly, I think it's best to find something that excites you and empowers you, and something that you really would like to bring to the table.
I would like to sincerely thank my colleagues, Brynn, Linda, and Lauren, for sharing their abstract writing experiences and their research with us today. I think they brought up some very important suggestions, tips from the experts that I would like to summarize with you. So I think one of the biggest or most important things is that no idea, thought, or question is insignificant. If it's something that's of interest to you, explore it further, look into it, do some research or literature review about it. One of the things that Lauren had brought up about keeping a list of ideas on your phone or your computer. So as you're kind of going through your day, open up your notes section, type in a little something and say, look into this a little bit later. It's a great place so you don't forget about it and you can refer back to it. Expand your knowledge on the topic. So do a literature review. Look back at prior HRS sessions or programs. Seek out additional information to try to get a better understanding. So again, trying to narrow your objectives down for your particular abstract. Get a mentor. I can't underline this enough. Either get someone from your institution who can help you, who has experience with research studies and writing abstracts, or you can reach out to a researcher of interest. So perhaps there's nobody at your institution who has a particular understanding of what you're trying to look at, but reach out to somebody at perhaps another institution who may be able to provide you with some insight about your particular topic. The Heart Rhythm Society launched this year an allied health professional mentorship program. As a member, you have the ability to tap into this resource at any time. So whether it be you want to talk to a mentor about your topic area, just want to try to flush it out a little bit further, see if it's worth exploring. Or if you actually need to get down in the weeds and get into the nitty-gritty with how to do statistical analysis or how to actually formulate your abstract. So the Allied Health Professional Mentorship Program is a great free resource to HRS members. I think it's important to do what excites and empowers you. Keep trying. I know it's very difficult, and we're working in the midst of a pandemic and trying to do our job with our families. But again, I think it's important, as I kind of stated at the beginning of this, that it's an important thing about advancing science. So if you come across an interesting idea or topic, write it up and get it out. And that takes me to my next point about publishing your findings. Linda brought up an excellent point about starting your manuscript when you start your abstract. Get going on writing at it. Sometimes this can be very overwhelming. So taking it piece by piece, kind of thinking back to the 5 tenets of what makes up an abstract, define what your objective is, figure out how you're going to implement it, figure out how you're going to do your statistical analysis if indicated, and your conclusion. Again, most of these abstracts that are being submitted are oftentimes anywhere from 200 to 300 words. So you have to be very concise. And again, as Linda said, keep the terminology the same throughout that. The abstract provides a great foundation for your publishing. And in the end, again, this is important in terms of advancing science for not only your colleagues, but for our patients. So thank you very much for your time. This is HRS TV, and I'm Julie Shea.